Hello again, Dr. S. In this presentation, I will be going over the second part of the assignment, which is addressing the staff. Good morning. In this presentation, we're going to be going over the CPOE for you staff members, and that's utilizing the computerized physician order entry system here at Springfield General Hospital. To provide an overview of what we'll be discussing, I'm going to give you an introduction to the CPOE system, what it is, and why we're going to be transitioning to it. We're going to go over the change process and discuss some of the transitions that you can expect to see within your units, as well as the teams involved and what your role is. And we're going to discuss sequenced implementation, so how we're going to roll out this change and how we're going to work through it. And finally, we'll close this session with a question and answer. So an introduction to the CPOE system, what is it and why are we implementing this system? So we have a problem. And what that problem is are medical mistakes. These medical mistakes are caused by prescribing errors. I'm sure many of you know within your units that there are issues sometimes with prescriptions and confusion over drugs with similar names, very common as well. And the unfortunate results are killing or harming more than 770,000 patients annually, and this is even within our own hospital here. In addition to harming the patients, we're also contributing to healthcare costs, and adverse drug events add several hundred billions of dollars a year to our mounting healthcare costs. The most common error we find that contributes to this problem are handwriting identification or poor or illegible handwriting by the prescribing physician. We understand that our doctors are extremely busy and sometimes mistakes are made and we can't always work through that. However, there is a solution, and that is the CPOE. So what the system is that physicians will put their prescriptions into an IT network. This will completely eliminate the problems associated with handwriting identification. This will be available to all of you within all of your respective department units to include both the treatment and the pharmacy staff. So this is great as far as cross-functionality. All of you will be able to work together to get this problem solved. The system will also catch all prescription errors, which are incorrect dosages, duplicate requisitions, patient allergies, and adverse impact statements. So as you can see, the pharmacy will be impacted by this, purchasing, as well as the treatment staff. So this is a great program for our patients just to mitigate any of the problems and help provide better care to our patients. In addition, the system will also display the patient's complete medical history as well as the latest clinical guidelines for treatment. So what this is doing is giving us at each unit a snapshot of the patient's medical history, their prescriptions, every step of the way, and you'll all have access to this. The same patient, the same history, and we'll be able to provide consistent care. So again, this is a great system and it has many benefits as compared to our current system. This is going to result in a significant reduction of error and cost. Most importantly, this is going to ensure the best care for our patients. We've all got into the medical profession because we care about patients. We want to take care of people, and this new system is going to ensure that we provide that best care for them. In addition, it's going to streamline the prescription process, which at the very end of it makes your jobs easier. So day to day, you'll have access to this IT system. You can see what drugs the patients are on and any potential interactions. And also, very importantly, it's going to save our hospital and our patients the cost of healthcare. So rolling out this change process, there's going to be a great deal of transition within your units, going from written prescriptions to this new IT system. As such, there are going to be new expectations. We've already briefed your managers with an overview of this process, so your managers are going to identify and make you aware of what the new expectations are as we go through this change. With new expectations, there are going to be new goals, and you're going to have new goals to meet. Of course, along with this change to the IT system, there are going to be new processes coming along the way. And the benefit of this new system is you're going to utilize the new system to meet your new goals. As with any change, there will be inevitably possible complications, but we're relying on you as the staff within your unit to identify these complications and let us know what they are. So the teams involved, the assignments and roles, the staff, all of you, extremely critical to the success of the CPOE program. And why is that? It's because you are the first people. You are going to identify the problems first, and you're going to let your managers know what those problems are so we can get them solved. Each of you have unique requirements within your units. You are the subject matter experts of your respective units. You're there day in and day out taking care of the patients, and you're going to see the problems first, and you're going to be able to head them off first, as well as see the great benefits of this program. So you have a tremendous opportunity to elicit change. And don't forget, the whole time while we're undergoing this transition, you are supported by your managers, counterparts in other areas, so you're all going to be supporting each other, and you're also going to have the support of the IT staff who are going to be putting this new system in place. Of course, your managers, as mentioned, they've been briefed on this as an overview of how to roll out the change from the bigger picture. But as I said again, the operational staff, all of you are at the front lines, and extremely important to making this transition seamless and as painless as possible. So sequenced implementation, how are we going to roll out this new system? We're planning to implement a pilot system in conjunction with our existing system. So it's not going to be an abrupt change. You're still going to have your existing system, so day in and day out you're going to be able to utilize that and make a seamless transition, which will give us the opportunity to work out any potential flaws prior to this rolling out hospital-wide. So there's not going to be any sweeping changes all at once. We're going to have a really easy and hopefully non-stressful change to this new system. Task alignment. So with the new system, there will be some changes in tasks. Your managers have been responsible for identifying and assessing key performance indicators that will be required for outstanding performance, which we are absolutely assured that you are capable of, and of still meeting these goals within the new system. And once again, do not forget that you are supported every step of the way. As with any new system or new change, there will be complications. There may be some stressors from day to day because it's different. It's something that you won't be used to. It's a change. But just please know that you have support, and you are encouraged to implement mutual engagement. So what that is that you have two-way feedback with your managers. If you identify something that is a cause for looking further into, or if there's a complication that you're seeing within the new process, you are absolutely encouraged to address this with your manager so that we can get these problems solved before they become bigger problems. And we're going to close this with a question and answer session. This is an open forum. I understand that there may be concerns. And I'd like to ask what all of you foresee as possible complications. So we're going to take this opportunity while we're all here together with our cross functions, our different units, to hash out some of these issues that you foresee before we start rolling this out. But also on the other side, what do you foresee as possible advantages of this new system? How would this new system solve the problems of the old system that's currently in place? And with that, we'll go ahead and open it up for all of your feedback. Thank you. And this concludes my presentation to the staff. Thanks again.